Hello, and welcome to today's learning session on health equity and Medicaid enrollment. My name is Avenel Joseph, and I am the Vice President of Policy at the Robert Wood Johnson Foundation, the nation's largest philanthropy dedicated solely to health. The foundation has been active for more than 50 years. It is a trusted, nonpartisan source of information on policies that enhance health and the effectiveness of the healthcare system. RWJF supports research and education on some of America's most pressing health issues, from improving access to equitable healthcare to supporting child nutrition and more. I am based here in Washington, D.C., and I'm available to help you with policy or research-related questions. I'll share contact information after this discussion, and I invite your questions and inquiries. Today's webinar is one in a series of sessions for members and staff to interface with RWJF and its grantees. This morning, we're discussing strategies to enhance Medicaid enrollment and how the program can be used to improve the health of communities across the United States, particularly the historically underserved communities your congressional districts serve. We all know that health insurance coverage provides people with access to the care they need at critical points in their lives. The COVID-19 pandemic revealed and magnified a significant coverage problem across the country. As cost barriers continue to prohibit many, especially people of color or those in low-wage jobs, from receiving the health care that they need. Medicaid covers 1 in 5 people in the United States, but the rate is higher in Black and Hispanic communities. Greater access to Medicaid is one vital option for improving the health of our communities. Without further ado, I'm pleased to introduce our 2 guest speakers for today. Dulce Gonzalez is a research associate at the Urban Institute's Health Policy Center. Her work has most recently focused on the impact of the COVID-19 pandemic on adults and families, with a specific focus on the social safety net, immigration, and barriers to healthcare access. This work is supported by the Robert Wood Johnson Foundation. Today, Dulce will share what the Institute's surveying has shown over the past year and paint a picture of what's happening in communities of color. We'll then hear from Emily Stewart, Executive Director of Community Catalyst. She'll provide an overview of learnings from the Foundation-supported Expanding Coverage Through Consumer Assistance project. Emily will highlight policy implications that caucus and conference members might consider to maximize enrollment for the diverse population served. After our speakers, remarks will open the floor to questions. After the speaker's remarks, we'll open the floor to questions. My colleague, Starla Stiles, the policy officer at the Foundation, will moderate the question and answer session. Starla, do you want to say a quick hello?
I am happy to be here today. Thanks, Avenel.
Thanks, Starla. To ask a question, you can click the Raise My Hand button at the bottom of your screen. For those joining by phone, select *9, and we will call on you in the same manner. And now, without further ado, I'll turn it to Dulce.
Thank you so much. And thank you everybody for the opportunity to speak to you all today. I am excited to be presenting on work that several of my colleagues and I at the Urban Institute have published recently and that highlight the ways in which the COVID-19 pandemic has affected Black, Latinx, AAPI, and immigrant populations. The views that I present today are my own and should not be attributed to the Urban Institute, its trustees, or its funders. So I'll begin by letting you know the data sources that we used, followed by a presentation of findings showing how the COVID-19 pandemic had a disproportionate economic impact on Black and Hispanic or Latinx adults. And finally, I'll wrap up with some recommendations that stem from the data. Next slide, please. So the findings that I will be presenting today primarily come from rapid turnaround surveys from the Urban Institute that receive core funding from the Robert Wood Johnson Foundation, as well as supplemental funding from the Spitzer Foundation. And select findings also draw from the 2018 American Community Survey. Next slide, please. Survey results from early on in the pandemic showed that Black and Hispanic or Latinx adults were more likely than their white counterparts to experience the economic fallout of the crisis, and these effects persisted even 6 months into the pandemic. So in September of 2020, more than a third of Hispanic or Latinx adults, represented by the first pink circle you see here, and nearly 3 in 10 Black adults reported that their families were worse off financially in September than they were at the beginning of March. And nearly 1 in 4 Hispanic or Latinx adults, represented by the second circle here, and 1 in 7 Black adults reported that they or their spouse or partner either lost a job or were laid off from a job since the beginning of March. Next slide, please. And so research from colleagues in the Urban Institute's Health Policy Center shows that Black, Hispanic or Latinx, and Native American adults faced much greater risks of exposure to the coronavirus at work because these adults were more likely to be working in jobs that were deemed essential during the pandemic, and B, in jobs that required in-person work. So here, if you take a look at the blue segments of each bar, you'll see that about 45% of Black, Hispanic or Latinx, and Native American adults work in jobs that were both essential and required in-person work, thereby increasing their risk of exposure to the coronavirus in the workplace. And while Asian adults as a whole appear to be more protected against exposure, given the nature of their work that can be done remotely and not in person, this does mask variability across various regions in Asia. So next slide, please. And indeed, if you look once again at the blue segments on these bars, you'll see that Southeast Asian and Pacific Islander adults were more likely to have essential jobs that require in-person work than adults who are East or South Asian. So for example, 38% of Southeast Asian and 44% of Pacific Islander adults were working in jobs that were considered essential and required in-person work, as opposed to 24% for East Asian adults. Next slide, please. Our research also finds that Black and Hispanic or Latinx parents with school-aged children faced hardship during the pandemic, with food insecurity being particularly salient. So about 4 in 10 Black and Hispanic or Latinx parents with school-aged children reported food insecurity in 2020, a rate that was nearly 3 times as high as that for white parents. Next slide, please. And one factor that could potentially hinder some Black and Hispanic or Latinx adults from getting the supports that they need to overcome hardships that they faced in 2020 is racial or ethnic discrimination when applying for social services or public assistance. And in recent work that is soon to be published, we found that about 11% of Black adults and 7% of Hispanic or Latinx adults reported these experiences of unfair treatment or unfair judgment in 2020, specifically because of their race or ethnicity. And these rates are much higher than those for white adults, excuse me. Next slide, please. And one other important dimension to consider for communities of color is citizenship and immigration status. And we are able to look at how outcomes differed by family citizenship status for Hispanic or Latinx adults. And we found that about 2/3 of Hispanic Latinx adults in families with a non-citizen reported losing work or income because of the pandemic. And these rates were higher than Hispanic or Latinx adults whose family members are all citizens, as well as those for white adults and Black adults. Next slide, please. In addition, we find that adults in low-income immigrant families were facing material hardship during the pandemic, with food insecurity emerging as the most salient hardship. As represented in the pink circle, you'll see that over 4 in 10 adults in low-income immigrant families reported food insecurity in 2020. Next slide, please. But despite the hardship that adults in low-income immigrant families faced, many avoided safety net programs, including Medicaid, SNAP, and pandemic-related assistance, such as unemployment insurance, because of immigration concerns. So as you'll see here, about 1 in 4 adults in low-income immigrant families reported these chilling effects on public program participation in 2020. Next slide. So what does this all mean in terms of connecting our data to policy? First of all, research does demonstrate that pandemic assistance could help mitigate the disproportionate economic challenges that Black and Hispanic or Latinx adults are facing. Our colleagues in the Income and Benefits Policy Center at Urban have used microsimulation models to estimate the potential effects for pandemic relief policies under the American Rescue Plan, and have found that these would have a profound effect on reducing poverty, particularly for Black and Hispanic or Latinx populations. Additionally, an end to Medicaid maintenance of effort requirements that were put in place during the public health emergency could disproportionately impact health coverage for Black or Hispanic Latinx adults, given that they depend on Medicaid more so than white adults. And while the American Rescue Plan broadened access to key pandemic supports for immigrant families, some mistrust and implementation challenges remain. Our research shows that even those who are eligible for programs may be avoiding these, despite the fact that these could help them weather the economic crisis. And all of this stemming around issues around immigration concerns. So building trust is a key step. Building trust with immigrant communities is a key step to overcoming these concerns. And looking to community partners for guidance is one way to address this issue. Further, greater attention to the experiences of unfair treatment on the basis of race or ethnicity that adults face when applying for or accessing public assistance could help improve experiences. These experiences of unfair treatment because of unfair, race or ethnicity can have a profound immediate and long-term emotional toll, but it could also lead some to delay or forgo getting needed services, which is something that we found in recent work. And this could result in greater hardship and difficulties meeting basic needs. And just finally, a final point, that disaggregated data could better provide insights on experiences of Asian American, Pacific Islander, and Native American populations. We do acknowledge that because of sample size limitations in our data, we have not been able to estimate many of the impacts that we present here for these populations, but disaggregation is important for understanding the degree to which outcomes vary for certain subpopulations. Next slide, please. So here you'll find some links to urban research. Happy to share these. And if you do have any questions, do feel free to reach out to me. You can contact externalaffairs@urban.org. Thank you so much.
Dulce, thank you so very much for those insightful remarks. I'm going to now turn it over to Emily.
Great, thank you so much, and thank you for having me. It's the mission of Community Catalyst to build the power of people to create a health system rooted in race equity and health justice. So this is an incredibly important conversation, and we're grateful to be a part of it. Community Catalyst's calling card is our commitment to partnering with local and state organizations on health issues that are most important to the communities that they are a part of. And connected to that, we have been working on education and enrollment since the beginning of our organization, which was about just over 20 years ago. And we continue to learn a lot about how people are experiencing health programs, including with respect to enrollment policy. And one of our favorite things to do is to share what we're seeing and to offer insights on how to make essential programs work better for communities, particularly those who are most harmed by our health system today. And so there's no more essential program in our view than Medicaid. And so delighted to be having this conversation, and you can take it to the next slide. So as Avenel outlined, one of the projects that I wanted to reflect upon is a project that we work on with the generous support of the Robert Wood Johnson Foundation. It's called our Medicaid Outreach Partnership. This is an initiative that is focused on supporting Medicaid outreach efforts across the country. Through this initiative, we work with national organizations to conduct outreach and education work, and that includes partnership with a broad range of organizations, including the Asian and Pacific Islander American Health Forum, also known as the Health Forum, Unidos US, Farm Worker Justice, the NAACP, and the Arab Community Center for Economic and Social Services, among many other national organizations. This group of national organizations works closely together to coordinate with local and state community-based organizations to conduct Medicaid outreach and enrollment work activities. This past year, our focus was primarily in Florida, Texas, New Jersey, Michigan, and also Oklahoma with the implementation of their new Medicaid expansion. And we've learned a lot about what people know and don't know about Medicaid, their experience with enrollment, and most importantly, what needs to change to better support the ability of Black and Brown people to get quality information about the program, what it can do for them, and how to enroll. And for more information about that program, you can also go to MedicaidOutreachPartnership.org, and you can take it to the next slide. So I just wanted to share a few key examples from the project that highlight both successes and barriers. The first is some really great work that Unidos US did, whereby they were partnering with food banks and flu clinics that were trusted by Latinx communities. That elevated the importance of leveraging trusted community-based service providers to get people information about important health programs, and that was really successful, drawing that connection between direct service delivery and the opportunity to enroll in aligned programs. Secondly, the Farm Worker Justice developed Spanish radio PSAs, which were focused on reaching migrant farm worker communities. The ability to tailor messages to this community is critical. You can't just use generic messages, and you also need to be thoughtful about platform. It was a great reminder that for some people in communities, radio is more impactful than TV or social media. And then the Health Forum did work that really highlighted the importance of translation for the Asian American, Native Hawaiian, and Pacific Islander communities. These translations often aren't available, and they really are critical to effective outreach and enrollment for people getting into the Medicaid program. So just to give an example of that, we had a partner that created a radio advertisement where they did work to translate ads that were specifically targeted towards elderly Koreans who might have had technological challenges in terms of seeing information online. Another partner in Florida tailored a campaign poster to make it more suitable for a Chinese language newspaper. And actually they got some calls from people, including from a man named Mr. Ma, who called to share that he had seen the ad in the United Chinese News of Florida, and talked about how important it was to him to understand that he could get assistance in Chinese around the Medicaid program, and how he would plan to tell all his families and friends about the Medicaid program having seen that ad. It's a small but I think powerful anecdote in terms of how important it is to make sure that translation services are being resourced effectively. Throughout the program, we have seen partners report increased capacity to do Medicaid enrollment as a result of this project, and also their opportunity to work and connect with others. And you can take it to the next slide. I also just wanted to highlight that at Community Catalyst, we also run a separate Medicaid public education program that is focused on creating a community of Medicaid ambassadors. These are people who are enrolled in the Medicaid program and talk from their own experience about what it has done for them, what it has meant to their life and their health. And right now we are working through that program and with partners in North Carolina, Missouri, Kansas, Idaho, who are focused on Latinx communities, Black communities, and immigrant communities with respect to getting information about, is telling personal stories about the role of the Medicaid program. And you can take it to the next slide. So what have we learned? We have learned that people quite simply don't know a ton about the Medicaid program. They don't know that they qualify for the Medicaid program. They don't know that they qualify specifically in their state. There's a number of states like New Jersey and Michigan where you might be surprised that people are aware of the Medicaid program, but they don't believe that they qualify in their own state. And importantly, a lot of people don't really have good information about what the benefits of the program are. So some of the best messages and materials lay out very clearly that people can get things like regular checkups, immunizations, and mental health care through the Medicaid program. The second thing is that people are much more likely to get enrolled if they have culturally competent in-language assistance from trusted organizations, with an emphasis on that trusted organization piece. And on that point, I do want to also add that review of translated materials by community-based organizations we have found is critical. Through this project, we've had community-based organizations review materials that were developed by professional translation service providers. And this matters because sometimes interpretation can be community specific. So CBOs were able to flag when languages didn't really have the practical meaning that it was intended to have. So for instance, a set of materials in Korean were altered to change certain meanings around the terms protection and security because in that community it felt like they wouldn't really translate in a meaningful way. Another important point is that people really are overwhelmed by the application process. We see over and over in our work, both through this project and other projects, that people really struggle with a confusing, burdensome application process, and also oftentimes with the experience of enrollment being treated disrespectfully and feeling like their encounters don't embrace the dignity that everyone should experience when they're enrolling in health insurance coverage. So this reinforces to us the need to both equip CBOs with more resources to support people, and then to acknowledge that there are real issues with respect to the antiquated systems and infrastructure at the state level. Also, people need to have support after they enroll. Issues really do arise after they're enrolled around things like cost sharing, what really are their benefits, how to access services, concern about a lack of providers. So you get over that first barrier of enrollment, and there are many more barriers for people in terms of trying to figure out their benefits, really like the way anybody struggles. But for people who are newly enrolled into a program that isn't resourced well from an administrative perspective, that can be really difficult. And finally, people from immigrant communities really need better information about the impact of the public charge rule. There's a lot of fear and misconception about whether or not enrolling in Medicaid will impact people's immigration status, and that is omnipresent. And you can take it to the next slide. Oh, sorry, this is a transition slide, so you can take the next slide after that. So I wanted to cover, three main categories of policy strategies. The first category is pretty straightforward. It is really just about making the investment and getting people the quality information that they need from trusted sources and the support that they need to actually work through that enrollment process. So in the first category, in terms of consumer assistance programs, these are programs that not only help people with enrollment, but also help people with accessing benefits, including appeals processes, helping them fight claims denials and surprise bills. It really gets to that finding around the importance of helping people exercise their coverage once they get it. So consumer assistance programs have been around for a long time. They actually haven't been funded by Congress since 2012. And so that leaves 19 states and 3 territories actually now without a cap. The second category is the Navigator and Consumer Assistance Counselors programs. We need these folks because these, like the CAPs, are people who really focus on intensive enrollment and help people get enrolled into Medicaid and the Affordable Care Act. Nearly 3 in 10 people who lost Medicaid coverage in the last 2 years could not complete the enrollment process themselves. So that is just one data point to tell you about how much navigators are needed. They are also much more likely to help uninsured people and Medicaid eligible people than agents and brokers. And Black and Hispanic or Latinx people are more likely to seek enrollment assistance. And so this is a very important program. Now, the Biden administration has announced new investments into that program since there are dramatic cuts during the Trump administration years. And while this is a critical step, really much more needs to be done to make that investment. And finally, I just want to highlight that community-based organizations need to be understood better as the trusted wraparound source of education, information, and outreach support that they are. A lot of community-based organizations don't have the capacity now, and maybe won't ever have the capacity to be a navigator, but they serve an essential function, and there does need to be more opportunity for them to be resourced to do the important work that they do, and to reduce barriers for them to apply for federal funding, including for those organizations who want to apply for navigator grants to do so. And you can take it to the next slide. The second category is around eligibility policy, and there's a few categories here. The first is around continuous eligibility, and that really just is designed to make it so that once people are enrolled, they can stay enrolled for 12 months. This would reduce the likelihood that Medicaid beneficiaries will lose coverage due to small changes in their income or administrative challenges. The second is around streamlined eligibility, or what's also called express lane eligibility. This is essentially a pretty straightforward, and it should be a simple and obvious thing to allow people to, if they're using other public programs like SNAP, the Nutrition Assistance Program like School Lunch or Temporary Assistance for Needy Families, that information will be used to enroll them into the Medicaid program. It eliminates the duplication of administrative effort, makes it a lot easier for people, and then ultimately eases people's ability to get the coverage that they need. And the next category is around Medicaid reentry eligibility and enrollment. As you may know, federal law currently prohibits any form of federal health coverage for incarcerated individuals, except under very limited circumstances. And so in many states, Medicaid coverage is immediately terminated when somebody is sent to a correctional setting. This disproportionately hurts Black and Brown communities because of the discriminatory criminal justice system, and it creates a serious coverage gap when folks are released and don't have an easy way to get health care. And this is particularly important for issues like substance use disorder and mental health. And so there's a number of policy proposals designed to create new flexibility for states to start benefits 30 days pre-release and to coordinate effective handoff for critical care. And then lastly, I wanted to highlight the importance of preparing for the wind down of the public health emergency. The recent estimates from CMS show that there's been a 13.9% increase in enrollment in Medicaid and CHIP. That's for a variety of different reasons, and including new policies and efforts that were initiated under the public health emergency. As a result, once that public health emergency goes away, maybe sometime in 2022, many states will have a backlog of cases for eligibility determinations. And just to bottom line it, a lot of people could be suddenly facing a cliff, having coverage that they desperately need and suddenly falling off. And there's a lot of different policies that CMS and Congress might explore in order to eliminate that. And then you can take it to my final slide, which is, both eligibility and some underlying program policy issues that have come up. The first is around counter-cyclical measures to support states during the economic downturns, as we have all experienced, and the COVID-19 pandemic has upended many things about our lives, also shined a great light on the deep inequity in our health system and society. And I think one of the challenges that it's shown a bright light on is the way that the Medicaid program is financed. So this policy strategy is basically meant to say that federal law should be changed so that when there are economic downturns, states automatically get increased support from the federal government. So it's not reliant on Congress to continuously keep acting. And then the second policy is about making sure that we are addressing underlying discriminatory policy that prevents coverage for immigrant families, specifically the policies that prevent immigrant families from accessing Medicaid for 5 years. So all of our work has really shined a bright light on the importance of limiting the 5-year bar. And then finally, just want to share that there's a lot that CMS can do regarding compliance. Some states are not adhering to reporting rules, transparency requirements, and other provisions of no wrong door approaches. And there's more that the federal government can do to make sure that states are aware of their obligations and that ultimately people get better access to information and the coverage that they deserve. Thank you.
Thank you. Thank you so much, Emily and Dulce. We will now move to the question portion of our event. To ask a question, click the raise my hand button at the bottom of your screen. And for those joining by phone, please select *9 and we will call on you in the same manner. I'm going to start with some pre-submitted questions. And the first question is for you, Dulce. And the question is, if you could sum up all of your work in the past 18 months, what's the single biggest finding you would share with policymakers that they need to know about?
Sure thing. So we know from other data sources, other researchers, that the pandemic had a disproportionate health impact on communities of color. And what our research really does, one key takeaway over the past 18 months really is to show that Black and Hispanic or Latinx adults were deeply affected economically at higher rates than their white counterparts, while also facing potential barriers to accessing safety net programs, including worries about immigration status, worries about immigration enforcement, and also the challenges around unfair treatment while seeking public assistance. So really, if the goal is to mitigate these hardships and job loss that families of color have experienced during the pandemic, then one potential pathway really is to improving access to safety net programs such as SNAP, Medicaid, to help protect against those long-term effects of food insecurity and insurance on health and well-being.
Thanks, Dulce. Our next question is for Emily. As public health emergency benefits end, how can states focus their efforts on ensuring continuous eligibility and enrollment?
Well, there's a lot that states can do. And, first of all, I think one of the things that they can really do is look to extending some of the policies that they implemented as a part of the public health emergency. A number of states, first of all, from a pure coverage standpoint, made benefits more comprehensive. They allowed people to get care in different kinds of ways, like through telehealth services, and also reduced cost sharing. So states should be looking to some of the things that they did to create better coverage and easier access to the public health emergency, and acknowledge that that shouldn't just be the case during a public health emergency. This is healthcare, and people should be able to have that care and that easier access, no matter what's happening with respect to the broader public health. Secondly, is to look at ways to ease basically renewals of enrollment into the Medicaid program. So doing things like not requiring people to come in to reapply for renewal, letting people do phone interviews, allowing for self-attestations with respect to income, doing, as I mentioned, streamlined enrollment. If people are in SNAP, just auto-enrolling them into the Medicaid program. So there's a lot that they can be doing. And then finally, just to highlight that for people who are losing their Medicaid coverage, states and the federal government, I think, should be looking to making sure that there's facilitated, warm handoff between the Medicaid program and other benefits that people might be might qualify for, like the Affordable Care Act marketplace plans. And by warm handoff, I don't mean just information like point you to healthcare.gov, but truly some, a quality, adequate assistance to get people into that kind of coverage.
Thanks, Emily. Okay, we have a live question from Thomas, and I'm sorry if I mispronounced your last name, Gerber Michael. Thomas, please tell us what office you're from and unmute yourself to ask a question. Thanks.
Yeah, no worries. You said it perfectly. Hi, my name is Thomas Gerber Michael, and I'm just coming from the office of Colin Allred, of Congressman Colin Allred. I really just have a simple question. I really found this sort of briefing to be very informative, and I really liked the presentation and everything. I was just curious if this sort of recording or the slides would be made available for future reference.
Yes, thanks so much. We will share the recording and slides, as well as links to all of the resources that Dulce shared during her presentation.
Perfect. No, thank you so much.
Thank you. Okay, so I'm going to go back to you, Dulce. What does your research and others tell you about the biggest challenge communities of color face when navigating enrollment process during the pandemic?
Sure. So one body of work that we have been developing over the past year or so has been understanding the extent of experiences of unfair treatment and judgment because of race or ethnicity when people seek healthcare or apply for social services and public assistance. And so we're finding obviously that these experiences are occurring much more frequently among Black or Hispanic Latinx adults. And importantly, that they're leading many to delay or not get completely the services that they set out to apply for. So obviously this is one challenge to navigating the enrollment process. And then also for immigrants, that body of work at Urban, and I'll caveat that not all immigrants are people of color, but again, understanding the intersection of immigration status and race and ethnicity is important when studying communities of color. But for adults and immigrant families, our research does show that immigration concerns were a hurdle to accessing safety net programs that could have helped many mitigate the hardships that they faced. And we also have a recent case study of California that will be published soon that covers some of the enrollment challenges that adults and immigrant families in California are facing, among them many that Emily pointed out around in-language services not being available, around the difficult navigating the enrollment process being a little bit difficult, but also just thinking that how the pandemic changed that in a lot of ways or made it more difficult with technology barriers, some families being difficult to reach or hard to reach because they don't have access to technology or because service providers had to scale back services, in-person services, and so reaching families was a little bit more difficult. So that's a little bit of what our research has shown over the past year.
Thank you. Emily, can you tell us what you're learning from state Medicaid directors, specifically about how they're funding efforts to raise awareness and enrollment?
I think that there's a number of states who have used their own resources to educate, so doing social media campaigns, other kinds of public awareness campaigns. And just like through the federal programs, a lot of reliance on community-based organizations and state-based organizations to do education and enrollment work. And again, would reinforce it, much like the federal government, the state governments, I think, oftentimes give very few resources to those organizations and ask them to try to make magic out of very little. And that's why we believe it's so important that as a policy strategy, members of Congress and the Biden administration are looking at how to get greater investment into those community-based organizations so that they can really be the companion to state efforts that they are and do it in a much more impactful way.
Thank you so much. I want to thank Avenel, Emily, Dulce, and all of you for participating today. We appreciate you giving us your time. Excuse me. We will send everyone a recording of this discussion with links to the resources I mentioned earlier, as well as how to contact the foundation if you require additional assistance. We'll also share a brief anonymous survey after today's discussion, and we would appreciate if you could complete it to help us plan future events. Thank you very much and have a great day.